I'd now like to introduce Congresswoman Gwen Moore, the first African-American elected to Congress from the state of Wisconsin. In the office since 2005, Congresswoman Moore is a former Democratic co-chair of the Congressional Women's Caucus. In this capacity and through her subsequent work, she has become a leader on issues like women's health and maternal and infant mortality. We're pleased to have her joining us today. Welcome, Congresswoman Moore. Bob, the floor is yours.
Congresswoman, how are you? Please, thank you. Thank you for joining us. So as Diana was mentioned, you've served as a leader of the Congressional Women's Caucus. So why have you become involved in this issue? We mentioned before you're a co-sponsor as well as a congressman of the Herrera-Butler legislation that could pass, it sounds like. But why have you become involved in this particular issue?
Well, I'm a woman.
Well, that's true.
I'm a woman, I'm a mother. I can recall 30 years ago this year, I was elected to the Wisconsin State Assembly, and I made a decision that I was not going to be stereotyped and pigeonholed into focusing on women and children's issues. And that resolve lasted about 5 minutes.
That long, huh?
5 whole minutes I held out before I saw some of the egregious kinds of initiatives that, when you think about it, legislatures all over the world, and particularly here in the United States, are male-oriented. The issues that they deal with they're structured to support men. And so when I saw that women and children were not going to get an even shot, it just didn't make any sense to do anything else other than to guard that flank.
This issue is, as the congressman was saying before, it's getting worse. It's 2018, and we're behind all these other countries as far as infant mortality rates. How is that possible, and what can Congress do, and what can the administration do? What can Washington do to turn the tide?
Well, I have had the really sad experience of waking up at 7 o'clock in the morning and taking that long walk from my house to the corner to visit a woman and her husband whose baby mysteriously died in the middle of the night, to give my condolences. But beyond that, even before I was elected, I participated in a group of women that did investigations of infant mortality, such as that, to try to go in and talk to the mom and talk to the people who lived in the household to try to figure out, did anybody smoke? Was there food insecurity? Were there rodents and vermin in the house? Was there domestic violence in the house? And to try to scratch beyond the surface. And with this Healthy Start grant, we were able to do that. Problem is that the collection of these data are inconsistent. There are different metrics. Some people are focused on, was there co-sleeping, but not looking at other indicators. And so I have a bill that I introduced last session. I'm going to introduce to this session. I'm still working on getting Republican co-sponsors. I think your last guest is someone I'm going to seek after immediately. It's really common sense legislation. It's modeled after my own experience to say, look, we need to come up with the metrics for examining consistent measurement and inquiries into infant deaths, do these interviews, collect these data. So we're doing worse because we have not collected the data so that we could put together those programmatic interventions that would support women. I think people have grabbed on to the co-sleeping piece. But when you look at African Americans who are they're 3 times more likely to experience sudden infant deaths. And it can't be explained through genetics. Then you have got to figure that there's something in the environment and the circumstances under which African Americans live. And that is what we need to get a handle on. What my bill would do is it would provide grants, such as the Healthy Start grant through HRSA, the Health and Human Services, provide various streams of funding to states so that they really can come up with, to develop this scheme of examination and to really fund putting the teams together.
You mentioned that you're looking for Republican co-sponsors. Is it hard to find, to work with the other side? I mean, it's such a polarizing time right now. I mean, this is obviously not a partisan issue. This is not the Affordable Care Act. But is it tough that when you try to get Republican co-sponsors on any bill, is it difficult?
It's very difficult because Republicans don't want to spend money. I suppose if the woman had enough self-esteem, she wouldn't have a miscarriage, or she wouldn't, her child wouldn't die. If she would just work. And so I think when you get caught up in some of these, ideological log jams, and when you have external persons saying that you can't raise taxes, it puts us in a jam. I mean, we just passed a bill spending $1.5 trillion, giving it to wealthiest folk and to corporations, and now they're looking at all kinds of ways to pay for that, up to and including, cutting Social Security disability benefits, cutting Medicare and Medicaid, and so this is a very tough environment to get funding.
As far as when you did those investigations, and I know it's anecdotal, and I know that the data collection system has its flaws, and that's what legislation is aimed at improving. But what did you find? I mean, what were some of the trends that you found? What were some of the reasons why moms and babies were dying?
Well, there were all kinds of reasons. I mean, people live in older housing stock, and so, I mean, and that's the problem. You can't pin it down to one thing. Housing, is a tremendous risk factor. Not only because it's older housing stock where there might be lead laterals or other sorts of problems, but people are under stress because they're paying, 75% of their income for housing. They're constantly moving. The stress of coming up with the rent, stress will cause congenital problems, high blood pressure in the pregnant woman, and passed on to the infant. Roaches, quite frankly, trigger asthma problems. So anyone who is suffering from respiratory problems, a woman or a child having any respiratory problems, that'll be aggravated by the presence of roaches. And of course, I don't have to mention the other kind of vermin that can occur in a house. Youth, the age of the mother, diet, nutrition, food insecurity certainly is a major factor in terms of the overall environment in which a baby is born. I can't tell you how many times I've taken a soda and a bag of chips away from a young pregnant mom and offered them something more substantial. But again, there are some things that are unseen. Stress, domestic violence, money problems. And it can't all be accounted for by co-sleeping. And of course, co-sleeping in and of itself is a problem. I mean, we learned with car seats, for example, that we should provide a car seat to women upon discharge from the hospital. Don't even take that risk that they're not going to be able to come up with the money to buy a car seat. And maybe we ought to have that same resolve with regard to discharging women and making sure that there are bassinets for their infants so that the temptation to co-sleep doesn't exist. Really, breastfeeding. I'm a big proponent of breastfeeding. Breastfeeding provides a safety net for infants in terms of warding off some of the disease and problems that they can develop, giving them the immunities that they need for the flus and various bacteria that are in the environment. Good health care. And so when you look at this, we really do need to put together a really solid investigatory tool rather than our just, citizens like myself walking in and speculating about the cause of death.
Mm-hmm. You mentioned diet and taking chips and soda away. I mean, do you think that there's a lack of communication from the healthcare provider to the mom?
I can tell you that many pregnant women don't get in to see their OBGYN early enough in a pregnancy or consistently enough. There are all kinds of problems. I mean, transportation, connecting with a healthcare provider early enough, lack of insurance, and it's not necessarily a lack of information. It's just practically what you do when you don't have a relationship with a doctor.
We'll also open up for questions for the Congresswoman, so if you can raise your hand and identify yourself and just wait for the mic.
Thank you, Thank you, Congresswoman, for being here today. My name is Uma Ramesh. I'm a student at Rice University. So the leading cause of death in women from ages 15 to 19 are complications from pregnancy. So I was wondering how Congress can work together to provide comprehensive sexual education in public schools in the face of rising abstinence-only advocates.
Oh, my God. That was a softball, right? Well, absolutely. We have got to get the general public, and I think the general public is with us. Maybe we just need to get members of Congress to realize that that part of women's health care is prevention of pregnancy, of unintended pregnancy. So if you're 15 to 19, you probably are not trying to get pregnant. I think the abstinence-only assumption is that women always have choices about whether or not they're going to be sexually active. I'm from Wisconsin, and for about 30 years, we were in the top 10, matter of fact, in the top 3 in the nation for teen pregnancy. And so we thought, is this something in the water? Why is it that we are experiencing such high rates of teen pregnancy? And so the United Way commissioned a study, and we found out it was from statutory rape. So if you're 15 and you're getting pregnant, and I actually know, unfortunately, more than one woman who's been in this situation, African-American women, they're 15 years old and they're pregnant by 30-year-old men. So you can make whatever kind of arguments you want to make about abstinence only, but here's a situation that, at least in a legal sense, these women were unable to consent to having sex. and yet they became pregnant. So I think it's really, really important to, to educate women, to make birth control accessible, on demand, and to educate men as well, and for there to be consequences about statutory rape. I know all too many women who were persecuted, as you say, for becoming pregnant, denied social services because they were a teen mom at age 15, 16, and nobody tried to extract any consequences from the person who made them pregnant. And so I think we have to, short answer is, we have to dispel the myth that women are becoming pregnant because they are miscreants and because they are sluts. And we have found this all over the world, that women are becoming pregnant at young ages against their will.
Time for one more question.
I'm sorry, I don't mean to be grabbing the mic. I wanted to bring to your attention a trend that I'm seeing as a pediatrician being connected with physicians and hospitals and health systems across the nation. You said we need good care, and our children need the good care too. Right up the street, MedStar Hospital shut down an entire pediatric program, an entire pediatric ER in Baltimore, in a poor neighborhood. In Dallas, in a poor neighborhood, 27 pediatricians were fired, and I've seen a piece on that. These pediatricians and the patients that they took care of are told, sorry, you're going to have to go to a kiosk. I actually sent an article on this to the Hill publication. Just this morning, I got a message from another friend of mine in Chicago that they're getting rid of all of their pediatricians in a city hospital. Why are hospitals given leeway to cut staff like this, and well-trained staff? I spent 4 years at Duke Medical School, 3 years at Northwestern learning to be a pediatrician, and I can tell you that the adult staff are not comfortable and not equipped to take on the role of taking care of children. It's really, in a way, it is a specialty. So I wanted to make you aware of that, and I don't even know that you'll have an answer because it's a brand new trend, but I'll take your comments on that, and thank you for coming and speaking.
Well, I thank you for sharing that. And just let me say, if it's a brand new trend, it may very well be connected to the fact that we just passed a rescissions package that took money away from the Child Health Insurance Program, from CHIPS, which, and institutions have to make those adjustments based on funding. I mean, they have to pay these pediatricians, and there is a funding source. And as I was sharing with you earlier, it is really hard to connect good public policy with folk who feel that we're spending too much money on the poor. And here we have an example of poor children. I just think, it's a shame. I mean, we are the laughingstock of the world. I was in London the first time CHIPS didn't pass. I was in London with some British parliamentarians, and they just looked at me and said, how could you not pass a children's health insurance program? And I just took one of the table napkins and dropped it over my head. And so you're saying it's a new trend, and you need to be loud about that and connect it with what we're doing here. Just out us on it.
Oh, I'm loud. Don't you worry. Here, once a month.
Good.
I'll come visit.
We've run out of time. Please thank Congresswoman Moore for joining us this morning.
Thank you.
Hey, that was great.